G'day and welcome back to the channel. So in today's video, I want to show you how you can use a massage gun to help improve your ITB dysfunction. And clinically as a physiotherapist, it's really important to mention at the top of this video is that absolutely no massage gun or anything like massage, dry needling, acupuncture, or any of those types of strategies will cure you of your ITB dysfunction on their own. Because it's important to understand that if you have developed ITB dysfunction, that is a mechanical dysfunction of your lower half, and it's been abnormal enough that that's the part of that system that isn't tolerating that environment. So by extension, any massage gun or any other modality that you might try to help relieve those symptoms will only be a symptomatic treatment, albeit a potentially really helpful and important treatment to consider. But if you're not matching what we're about to go through with the massage gun up with some broader thinking about why it's there in the first place, then it's unrealistic for you to expect a massage gun to cure you of your ITB dysfunction on its own. Because we're going to go through the massage gun techniques today, I'm going to take the Bob and Brad T2 massage gun that they were good enough to give to me. If you do feel like a massage gun is something that you want to invest your hard-earned money into, I'll leave a link in the description below. But getting into it, what we need to understand about your ITB is that your ITB isn't like muscular tissue where it becomes tight. It's a very robust, fibrous connective tissue that runs from your gluteal muscles at your hip down through towards the top of your knee. What's interesting about the ITB is that iliotibial band also goes down and inserts into the outside of your thigh bone. It's very similar to a steel I-beam where it doesn't necessarily move you, but it acts as an attachment site for your quads, your hamstrings, and your gluteal muscles. So it goes without saying, when we're using the massage gun, we're not necessarily trying to mobilize or free up the ITB specifically. What we're actually trying to do is try and mobilize the tissue that attaches into that ITB to feed some slack into that tissue again, hopefully take away the extra tension or the circumstances that could be irritating that knee, causing you pain and other dysfunction. So what we want to look to do is we can start by going through your quadriceps, as that tends to be one of the main tight and overtly symptomatic areas that contribute to ITB dysfunction. And what I normally like to do, and if you've seen some of the previous videos that I've done on massage gun usage, we want to resist the urge to do what you might intuitively want to do. And essentially, when we think massage gun, we think of putting the head of the massage gun onto tissue and then gently sort of massaging and rolling that tissue up and down to get the desired effect that we're looking for. But we can actually be a little bit more specific and a little bit more nuanced to get more out of this, to make more mobility gains and to help your tissue move better, more efficiently. So what we want to get you to do is, if we can go looking for some of the tightness, again, not right down the side of your thigh where your ITB is, if you can imagine that there's a line going straight down through your thigh and another one slicing that through the middle at 90 degrees, it essentially leaves us with an outer quadrant of your thigh. This is where a lot of the tight quadricep tissue tends to be that attaches into that ITB. Put a little bit of pressure through the area, try and find anything that feels a little bit tight and thick. And what you can do is, once you've found that, we can then pin that tissue down and then try and use movement through your leg to shear that tissue free. Now, obviously you want to try and bend your knee and pull that tissue past the massage gun as best as you can. This is essentially a tack and floss or an active release type movement, but we're also getting the benefit of that vibration as well to increase our chances of shearing tissue free. And once you've found that spot and you've loosened up a little bit, feels maybe a little bit less tender, we can then move it around to find the next most tender spot or the next most relevant spot for you, pin it down, again, gently bend and flex that tissue as best as you feel comfortable. Now, obviously, we don't want you to go close to bone. It won't feel comfortable, but it's up to you to find as much of this tightness as you can and then try and use movement to shear that tissue free as best as you can. Once you spend some time working all the way up and down that sort of outer quadrant as your quad attaches into that ITB, we can then do the same thing for the tissue through your hamstrings. And again, we want to take the same approach where if we were to look at you as a lower quadrant where that hamstring attaches into that ITB, we again want to go looking not directly on the side, but just underneath that. So you find something that feels a little bit tight, a little bit tender, which is that way for me. And then from here, again, we want to straighten your leg out to try and shear the tissue free in that direction as well. Try and make sure that you're staying right on the spot that feels tight. Try not to let it sort of slide off at all. Get a bit better contact there. And same deal again, once you've found some of those spots, move on to the next ones. Keep working your way through these areas as best as you feel comfortable. And what's really interesting is just working on those two structures to begin with. So not the ITB, but the quad and the hamstring as they insert into that ITB. If you can then stand up again and walk around and see how that knee feels, you should automatically feel like there's more mobility there straight away. And if that immobility was contributing to your pain and dysfunction, then you should deserve to see a change in how your symptoms feel as well. Again, these are symptomatic treatments. They're not going to cure you of your ITB problem. So if you have been able to take away some of your ITB pain with your massage gun, then that's obviously fantastic. But we then also need to make sure that we're working on your glute strength or your hip mobility or your ankle flexibility or your lower back function to make sure that you can restore normal loading to that tissue to take away the reason why your brain feels the need to be dysfunctional here in the first place. So once you've done that through the tissue closer to your knee, the other areas that we want to focus on cover more towards the hip region. Again, where those gluteal muscles, your TFL or your general glutes, as they attach into that ITB from the top. So as we move our way up from the tissue that resides closer to the knee and probably closer to your ITB symptoms, we want to make sure that we come up towards those glutes, that TFL and your general gluteal tissue towards the back to see what other restrictions might be there from above. Now, the first one we're going to start on is your TFL, and a really quick guide to where that might be is if you can find the ball at the side of your hip and also find the bony prominence at the front of your hip. In between those two areas is where the TFL will generally be for you. So again, taking the same approach that we did before, we want to be just outside of that hip bone at the front and just inside that hip bone at the side. And it might be easier for you to lie down and do this, but what we're looking for is the same thing. We're looking for anything that feels tight, tender, or thick and restricted. And again, once you've found it, so there's a little bit of tightness there for me. Ideally, you could extend your hip and do this at the same time, but the other thing that you can do here is keeping your leg straight. You can gently twist your leg in and out to shear some of this tissue free in this way. Again, once you spend some time there and you feel like it's softened up a little bit, maybe your foot's turning further than it was before, we can then move it down a little bit lower and keep repeating that process again until you capture all the things that you need to feed some slack into the front top aspect of that ITB. And then once you've done that as well, we can then focus on the meaty glutes. So again, it's really nice to do this lying down. And if you can find that hip bone at the side of that hip, again, we want to be just behind that and working our way around that hip bone. So again, a lot of this will be based on feel. Again, there's a bit of a tight tender spot there for me. So again, same thing. If you straighten your leg out, and it does help to have your sort of hip bent up a little bit to begin with. If you can straighten your leg out and again, turn your leg up and down, try and rotate that hip again to shear free some of that tightness, to open up that tissue, and then again, move down to where you feel the next most tight spot might be for you, and then keep repeating that same process. So it's not the most technically difficult thing to do, but the real benefit of doing this comes from your thinking around where you do it and why you're doing it. Same things we found below. As soon as you've done that hip, you should automatically feel like your hip is that little bit more mobile than what it was before. And then anything that you would typically find reproduces your ITB symptoms, whether it's squatting, going up and down stairs, try that again and you'll hopefully see what impact, if any, this is having on your symptoms. So ultimately, it's really important to understand that a massage gun, while having great potential to improve your symptoms and how mobile and comfortable your ITB feels, is only ever going to be a symptomatic treatment in the same way that getting a good massage, getting acupuncture, dry needling, and anything else in that space, each in their own right can contribute an amazing amount of benefit to your current situation. But I need to keep stressing that if we just do this on its own, it may make you feel nice, but it will never get you to the stage where you've cured your symptoms and you've corrected the overlying or underlying mechanics that have asked those symptoms to be there in the first place. So please let me know in the comments down below which of those 4 areas you found was the most tender, and also how each one of them maybe influenced your symptoms. If you are interested in purchasing a massage gun for yourself, this is the Bob and Brad T2 massage gun. Again, I'll leave a link in the description with the discount code attached if you are that way inclined. But ultimately, we need to make sure that you find something that gives you relief, and then also take a step back and understand what through your back, hip, knee, or ankle isn't doing what it should be doing to stop those symptoms from coming back long term. So once again, I genuinely hope that was helpful. Please let me know by leaving a like on the video, subscribe to the channel if you enjoy this type of content. But once again, thanks for watching, and I'll see you next time. Bye.